We do weigh the square footage. You know, to effectuate a self-isolation plan, and this is always, there are a number of technical details. So a self-isolation plan has to have a separate, has to fundamentally separate out the people who are on self-isolation and those who are not. And so we would review any plan that meets that goal. We would review any plan that meets that goal. So if it has a separate entrance, a separate bathroom, separate bedrooms, separate kitchens, separate fridge for those 3 people, of course, of course. And when there's any gray zone, the staff come to me and I look them over. And we always try to work the most facilitative way forward. I think it's 95% of the applications are approved, and there are only a few that are outstanding. So I'm always willing to look at any individual level plan. I can share this as a technical item. We asked for a farm-specific plan. That was what the order said, because recognizing that each agricultural enterprise is different. Sometimes the plans that might be effectuated may on the face of it meet the 2-meter rule, but they're also otherwise not consistent with other rules, like access to an egress, so that people can get out in a fire. The Public Health Service is not the only agency that follows physical spaces, and that's been historic. We've inspected bunkhouses before, but fire and building inspection also has a role to play in it. So we definitely will look at any plan, and moving forward, I commit to looking at any plan that that seems, as we've always done. I review all the contentious items and try to help the staff along with them.
We're going to hear from staff, our CIO.
Thank you. Just to address Councillor Martin's one question with regards to working with the agricultural community, I think we are trying to make steps to increase that. I do want to, I do want to say that there has been significant outreach, and Marlene can certainly track the number of phone calls and the daily activities that we spend. We have over 40 staff, frankly, working strictly on the agricultural file, and they engage with farmers on a day-to-day basis. The other thing I would say is, as board members of health and as Dr. Shanker, he has to make a risk calculation, and in my consulting days we always look at a risk framework. And I think what may be useful is that we bring back the risk factors to council so that they understand it. So, for example, when now the federal government and the in BC and British Columbia and PEI, they look at the economic risk factors for the farmer in these analyses. So when you have one person self-isolating and they show signs of illness, not even testing positive for COVID, but just showing signs of illness which would require them to do another 14 days. If you have one person isolated, you lose 27 working days. If you have 20 people isolating together, you lose 540 working days for that group. So and then there's grades in between those. So there's economic factors on both sides of this issue, not just on one side. Because as you increase migrant worker cohabitation, your economic risks increase to that. And that's why British Columbia, I would encourage the members of the board to look at what British Columbia did with their program, because they switched when they started having outbreaks, and and their response to that. And then there's a multitude of other risks that the board members and Dr. Shanker have to do. So I think in that 2-week period, I think we could put together some documentation to say, when you're looking at this one issue, these are all the risks as a board member when you make a decision, or when Shanker makes that decision, he has to decide upon and what those implications are. An actuarialist, who is what they used to call jokingly an accountant without a personality, what they would normally say is, well, if you increase it from 3 to 5, we would expect a death rate of 4 people and 600 people to get sick. Do you want to accept that risk or not? And I hate to be that cold and calculate it, but that's what an actuarialist would do. And unfortunately, that's what Dr. Shanker's been placed in this position to do, of making those kind of calculations, because every time you make a decision, there's a possibility of a death, there's a possibility of more people being sick, there's more delays in it. And though we can't do the math, we can certainly outline the factors that Dr. Shanker needs to review to do that. I think if the board's okay with that, we can work with Dr. Shanker on developing that risk framework and some of the analysis that goes on.
Board Member Chop.
Thanks. Just one other, just to add on a little bit of what Jason was saying in terms of that risk analysis, and to tie in your comments, Councillor Van Passen, about how we have increased our ventilator stock. You know, yes, what our public health department has achieved through this pandemic, I am blown away, actually, and they have. The entire team has worked 7 days a week, day in and day out. I hear from Arlene and Shanker between 8 and 10 p.m. every night. And they're still at the office at that time. And yes, we've gone, and Shanker's had ventilators that have been made for Norfolk County. I can't think of too many other counties that have 50 ventilators that have just been produced for them. But at the same time, if it was you, did you want to be in one of the 5 ICU beds hooked up to a ventilator in the hospital? Or did you want to be on a cot in the hockey arena with a ventilator? And so, yes, that capacity is there, but it's not capacity that we want to use. It is a last resort in the case of, you know, a major outbreak in our community. So the argument that now we have all these ventilators and so we're good to go and chance it, it doesn't fit into that risk calculation in the same way that I think that you think it does.
Member Van Passen, with respect, I'm going to let Board Member Taylor speak. He's been waiting some time.
If Councillor Van Passen wants to respond to that, I'd be happy to let him in.
No, Councillor Taylor, he says you can go ahead.
Okay, so first, through you, Dr. Necessary, if you say that there are 4 outbreaks on farms right now, sometimes the audio was cutting out, so I didn't quite catch that. There are 4 positive on-farm cases. Was that said?
There are 4 outbreak assessments. So whenever we have someone in isolation residence who's sick, we make an assessment of if they have COVID-19 or not. We also order investigations on them. And if in fact they have, if you test positive or test negative, you still have your self-isolation period extended, because we always make the assumption, the most conservative assumption, that you are sick and you have the likelihood of infecting other people. I don't want to talk too much about the details of that, just as much as we can to protect privacy issues. But that is the fear. That is, if you, those are the things that keep me up at night, which is that if someone arrives at a self-isolation residence and they're congregating with 10 or 15 other people, that those 10 or other 15 people will need to go on quarantine. They will need to find self-isolation residences for them. We'll probably exhaust, you know, if it's many of the staff that we currently have to conduct outbreak investigations and others. You know, recognize. So those are the things that I'm concerned about with these events. And we don't know until, and it's just, it could be one event that could end up causing significant problems for the health district and for the migrant farm workers. I always worry, you know, whenever we think of outbreaks as doctors, you think about the patients who are experiencing adverse consequences, but also the fact that they could spread the illness to other people who are part of their contacts. Right now, we're doing okay because we have put lots and lots of people in self-isolation. We've tested lots of people and we've quarantined lots of people, but it only takes a few cases to cause an outbreak. Congregate settings, which are just not bunkhouses, but in this health district there are a substantive number. Hotel, hospitals, retirement homes, long-term care settings. They're all areas of real challenge for outbreak, and that is part of the reason we've taken these very assertive steps. And in fact, the reason we're seeing few cases in part is because of all the efforts of the people at the Public Health Service. The reason we have ventilators and other districts don't is because we had someone make the ventilators for us. Other districts don't have 50 ventilators in store, don't have access to many of the things that we have in our health district. So I think the challenge is always that how do we balance all these competing risks and all the different judgments we have to make. At the end of the day, it's about how much and this is a very hard thing, and it's a hard thing to talk about, is what our public health strategy is to disrupts the lives of young people, families, and businesses so that elderly people won't die of COVID-19. That's really our fundamental goal. And then how much effort and how much disruption are we willing to put forth to try to effectuate that? That's the judgment call I have to make, and with the help of my public health team. We make that every single day. And we make that as delegates for the Board of Health. In many ways, I always say things are going okay. I think things are going okay. But we act in the Public Health Service as delegates for all of you. And we try to work in the background. One of the reasons I'm reluctant to speak is because we try to do things quietly and privately. So, and we have this competing challenge, which is that migrant farm workers or seasonal agricultural workers are an important community to us as well. Because some of them, many of them come here without families, and they come here to work. So this is the balancing act that we have to put forth with this situation. At one level, we want to keep everybody safe. At another level, we don't want to cause any unnecessary disruption. Where we are on that pendulum, it's hard to know sometimes. On March 24th, if we look at the curves, the March 24th, when this all came about, it looked pretty bad. It didn't look good when we had 21 cases and 100,000 people. And if you know that there are 21 cases, there are probably many, many more infected or unknown. Today, we've suppressed the cases, and our goal now is to work on congregate settings, because that's where we think the cases are probably going to pop up. That's what led us to this point. Do we always make the right decisions? No. In retrospect, as a doctor, I would tell you there are days I ordered a CAT scan on someone who didn't need a CAT scan. I only know that after the fact. Or I ordered an MRI or hospitalized someone who didn't need to be hospitalized. On the other hand, I could never live with myself if I missed someone with a brain tumor or a bleed in their brain. Can't live with ourselves. It's the same thing for the counties. If it's a choice between ordering more tests, ordering more investigations, quarantining more people so that people can live, then that's what we'll do at the Public Health Service. From the day that I got here, and the reason I took this job was to try to make a difference in this world. And it isn't unpopular, and it can be unpopular. This is not the first time that not everyone has agreed with me, but the real balancing act is how much an inconvenience do we want to try to save a life? And that's not an easy question, because, that's not an easy question at all. And so as we move forward with this, we're just trying to manage risk as best as we can. I'm sorry for being so long-winded. My apologies.
Thank you, Doctor. Councillor Taylor, you have a supplemental?
So if this passes today, what is anything going to change for you tomorrow? Is a request? This isn't an order. You're dealing with this every day, looking at the numbers, I'm sure. So what difference would there be?
Yeah, so it would, we serve the Board of Health at one level, and the Board of Health serves the population. It would not, I don't think it would be a positive day at the Public Health Service if the people that we have worked hard to protect through their Board of Health, and we've done a good job. I think by an outside standard, the people of the Public Health Service have done a good job. So it would be viewed as it would not be viewed positively, I think, by the staff, and it would not be viewed positively by me. So it would be a disappointment, surely. The Section 22 order and this is what the statute was designed to do, is the statute, the legislature requires, and it still requires me to try to make the best decisions for health for the 10,000 people. And for me, for the people who live especially in that areas where there's a lot, who live in Norfolk County especially, I would continue to advocate for them like we've always done. So it would have disappointment to the Public Health Service for sure, but we would try to continue on doing our job to serve the people in the district.
Thank you, Doctor. I'm going to just check with Board Member Van Passen if he is still prepared. And with the Board's indulgence, I would like to expedite this discussion. I will allow Board Member Van Passen and then Board Member Martin to speak, and then we'll proceed from there.
Thank you, Mr. Chairman. I did find what I was looking for. I brought this up before, so I might have to ask the mover and seconder if they really want to follow through with this motion, because there is absolutely nothing in the actual order that limits the farmer to 3 workers. And what is in the order is that they have to spend 14 days in isolation, that they have to prepare a self-isolation plan. Farmers don't want an exemption to the rules. They want everybody to be isolated. They want to do it. But it's only when you get to Part B, when you look up how you go about developing your self-isolation plan or your isolation plan for your workers, there's a little asterisk at the bottom of the page that says at no point are you allowed more than 3 workers in a building. So I don't know if like, farmers don't want carte blanche on everything, but they do want some reflection on the conditions have changed and on that number, but they're 2 separate parts. So I would put that question to the mover and seconder, whether your intentions are correct with what the facts are.
Board Member Martin.
Thank you, Member Michele. I guess I would just, in an effort to keep this conversation rolling towards a vote, I would go the opposite of Councillor Taylor's question to Dr. Nessathari and say, should this motion not pass, are you and your team clear and concise on the messaging that's coming from this Board of Health to you, which is an emphasis on communication with the ag community, a commitment to streamline the program, and a commitment to reevaluate the plan tomorrow, regardless of what happens with this motion?
Yeah, the short answer is yes. The answer to that is yes. You know, to the extent that so I don't want to diminish the answer yes, but when we talk about, there are farmers who have put in, or I believe, who put in structures so they can effectuate using their space more efficiently. And one of the reasons we constructed the order in this way is it's a farm-specific plan, because every farm is different. Some people, we would definitely, and I would definitely, and the staff would definitely look at these plans. And I could just, because there's a multitude of possibilities. One is that if you have a large bunkhouse, is that if you have 2 separate entrances and 2 separate bathrooms and 2 separate fridges, so long as you put up a temporary wall, that could effectuate a self-isolation plan. I believe one farmer, in fact, had actually effectuated that. Just work with and there is lots and lots of dialogue between, because every one of these enterprises, everyone has a public health inspector who works with them. But if the question is, can we have more dialogue? The answer is yes. We can definitely have more dialogue. And I can ask the staff just to redouble our efforts on that part of it.
Thank you, Doctor. I will let the mover respond to the previous comments. Board Member Huffman.
Thank you, Board Member Michele. I have a question that I've been wanting to ask, and we didn't get a clarification on it during Dr. Nessathari's, I can't even think of the word I want, his Oh, never mind. What my question is there was another Section 22 order that was in place regarding secondary residences, and that order was rescinded just prior to the long weekend. And I know as a board member, I haven't received a whole bunch of consultation regarding any of this, any of the orders or any of the workings during this pandemic. But my question is, why was that Section 22 order rescinded on the Friday before the long weekend?
Yeah. Madam Chair, members of the Board of Health. Go ahead.
Dr. Nesathere, with respect, I'm just going to exercise my authority as the chair. Just Board Member Huffman, I don't think that that comment is relevant to the motion that's on the floor.
Well, it is relevant to me because I'm trying to figure out, first off, that we're looking at in terms of Board of Health, and I'm trying to make sure that I make a very educated decision here. So if there was a Section 22 that was in place and it has now been rescinded, I think it prudent that we know the reason it was rescinded and why this other Section 22 is still in place. So I think it goes to, I think it lends itself very well to the education of our Board of Health.
Member Huffman, with respect, I don't think the motion is intended to educate the Board of Health. I do think we could perhaps address that on another topic, but for the time being, I'm going to limit the discussion to the actual motion that you have made.
All right, thank you.
Clerk, just to have clarification, and I do want to recognize Board Member Columbus if he has a brief comment to make.
Well, I do have a question to the doctor, again, and I just wonder, I was expecting that there'd be some movement with respect to the Section 22 three-person per bunkhouse limit, and I thought perhaps that you'd loosen up and go to perhaps 6, being that COVID is, or the curve is coming down. I didn't see that happening, and I'm sorry that it's come to this, and I thought you'd have some flexibility. Can you comment on that? And how soon, if in fact you did start loosening up, how soon would you be doing that?
Yeah, so 14 days is the time frame. That's one incubation period. The issue of the number of people is about the amount of risk. It's not about the community risk, but it's about the risk of infecting one other person in the seasonal agricultural residence. Now, one can configure a bunkhouse so that you can accommodate more people by putting a temporary wall or creating some structure. So that is a different issue than community risk, which is when people get sick at their homes or get infected at the grocery store. I think that, clearly we can have more dialogue for sure. The Public Health Service has always been open to people configuring bunkhouses in such a way. But the clustering of 3 people at a time doesn't change because of community risk. Now, at some point in time, I think that we may just elect to have a different process for evaluating bunkhouses and other congregate settings. Congregate settings are our number 1 priority right now. It's just not my priority, but it's also the province's priority for that. It's like asking a doctor, but you need an MRI tomorrow. Well, I can only tell you if you need an MRI tomorrow when you come to the clinic and I take a look at data that tomorrow, or will I live a month from now? It's hard for me to predict the future. But I can commit to this, that we're doing everything we can to contain COVID-19. We follow the data, we follow the risks, we make our best judgments based on the data that's available to us. And we can continue to have dialogue on this item.
Mr. Clerk, just for clarification again, would you read our motion?
Sure.
The motion reads as follows, that the Board of Health request that the Medical Officer of Health repeal the March 24th, Section 22 order due to its adverse impacts upon the agricultural sector for the following reasons. 1, it exceeds the provincial and federal regulations. 2 was removed, that was the financial hardship. And 3, that the order contributes to food security issues.
All right, so I'll do the recorded vote now, Chair. All right.
Yes, please.
Councillor Geisens. Yes. Councillor Rabbits. Councillor Columbus. Councillor Van Passen. No. Councillor Martin.
No.
Councillor Taylor. No. Councillor Huffman. Yes. Mayor Chop. Chair Michele.
No.
The motion is defeated 5-4.
That went by pretty quick. I didn't have an opportunity to respond. It wouldn't be the first or second time this this Board of Health meeting.
I'm sorry, Board Member Rabbits. I thought I heard you say something, but I will admit that I did not hear you say yes or no. I thought I just heard something, and the sound is not perfect back here. So,
Oh, sorry.
Mr. Clerk, did we miss?
Sorry,
Board
Councillor
Member
Rabbits.
No.
No, okay. Sorry, I had you down as a yes. It was 6-3.
Okay, I guess I'll take back over there.
Yes, that
Member
sounds
Michele,
fine.
thank you for that.
Madam Chair.
I guess I just would say this to the farming community, that's, you know, I find it, again, Mayor Hewitt and I have not always agreed with the decisions that have been made, but I also respect the rule of law and the way the Health Protection and Promotion Act was structured. And, you know, from every, I had a famous meeting with Minister Clark at Roma this past January, and the basis for that meeting began with fighting for a farmer's rights for lot swaps. I think I've been I looked at your it's coming later in the agenda today, but the Agricultural Advisory Board minutes. And I think I've pretty much led the way in advocating for you guys every step of the way on provincially significant wetlands, on tree bylaws, at AMO with Minister Hardeman on changes to the building code for bunkhouses so that you didn't have to, you know, move to the camp for migrant workers status. Again, with the lot swaps, it's just changing, you know, allowing that second severance. This council has also promoted changing the designation from prime agricultural land to rural land. Actually, I do have, quite happy to provide that for you, Councillor Huffman, but the mayor is actually allowed to speak after the vote, and I'm the only one that's allowed to speak after a vote.
You're not speaking as the mayor, you're speaking as the mayor, you're not speaking as the Board of Health Chair.
It's our procedural bylaw.
You're going into things within council.
Well, as the chair, I'm overruling you, and I'm speaking.
Point of order, and please note that, sir.
In any case, our council has, I think, demonstrated that we have fought fiercely for many of the changes that the farmers have wanted to see, and we will continue to do so. And I know that this is difficult. The whole pandemic is difficult for a lot of people. And again, you know, to Councillor Martin's point, we want to do as much as we can to try to rebuild that relationship with you guys, and we're certainly, our doors are open anytime. Okay, so moving on, I guess communications. Do I need a motion for that there, Andy? Councillor Van Passen, is it in regards to?
It is in regards to if motion just failed, but that doesn't stop us from putting another motion on the floor, does it?
Okay, if you have another motion?
Like, the only reason I voted against that nobody's asked to eliminate the entire policy, but to ask the medical officer of health to reassess the changes in conditions since March 24th and work with the agricultural community to develop another set of criteria for occupancy of the bunkhouses within the quarantine period would be more than fair to put on the floor, would it not?
I think Shanker's already acknowledged, he continuously reviews all of his orders every day that he's in the office, 7 days a week. He's looking at the new data, the new trends. He's constantly evaluating that. So do we need a motion to him to direct him to do something that he's already doing? No, I don't think so. And we've made a commitment here. You've heard it from staff. I mean, the doors have been open to the agricultural community. In fact, you know, the same gentleman that is now suing the Board of Health was somebody who I put on a task force to be able to go and create a program that would make it as easy as possible for the farmers, because I knew, because I talked to Shanker every day, that he was not going to change his mind. So we could sit there and we could argue till we're blue in the face over it, or I could try to put another solution on the table that helped to address the farmers' concerns at the same time. And it was shot down by the 2 members on the task force. So he's already agreed to Councillor Martin in the debate that he is going to engage with the farmers, that he is going to review his order. He's already been doing that on all of the orders on a daily basis. So I'm not sure why we need, other than if it's political posturing, why we need a motion to direct him to do something that he's already been doing a hell of a job doing as our medical officer of health.
I take it you're not seconding my motion?
What's that?
You're not seconding my motion?
No. Councillor
There's no
Michele?
seconder, it dies.
Thank you, Madam Chair. I just, with Board Member Van Passen's suggestion, I would like to get some real clarification, because I'm getting a little bit of mixed message about the doctor's review of this order. I think earlier when I was asking him questions, he indicated that he would be doing it on a bi-weekly basis, but he did indicate at the same time, after he said that he would be submitting a review of this in 1 week from today. So I just want to be clear about the time frame that we have, so that we can establish that today, so everyone watching and everyone present is aware of what the time guidelines are.
Sure. So this is what I was thinking, and we're always open to dialogue. We have shared data, the statistical report and the charts and the tables with the broader community. And I think on the next statistical report, I'll have a summary on where we are with seasonal agricultural workers and how that reflects in our planning as moving forward. So that we can commit to. We're more than willing to have dialogue with members of the agricultural community, and we do that through our public health inspectors, and we'll continue to do that as well. Is there another item that you'd just like me to be sure that I comment on in that report, or?
Well, Dr. Minister, I just want to know, after we all leave here today and we think we understand everything, then, somebody emails any one of us tomorrow, the next day, I heard that he's going to be reviewing the order. It would be nice for all of us to be clear. Like, if you were to tell us that order, you will issue some kind of a communication on May the 26th, that is your period of time you have reviewed it. Perhaps at that time you have not changed your mind, you want to maintain the status quo, that's fine. I just don't want this to be one of those things that sometimes, with respect, the communication kind of breaks down, and then we're all wondering, oh, I thought we were supposed to hear something about that, and then we don't. So I just want to make that really clear today.
Sure. And you know, in my written communication, I will say if the order should remain or be modified or changed based on the data that we have, for sure. That's what we would always want to do. You know, and I'm glad that you told me this because that's a point that we always want to do is to have that clarity. I can share with the board that we look at the data elements every single day, and we look at the new cases and if there are clusters and all the long-term care facilities. So we'll continue to do that. But in my report, I will comment specifically to that. Either the item stays as it is or it's modified, and we can do that for sure.
Again, Madam Chair, thank you, Dr. Necessary, but I'm still asking you if you can identify a time frame. When would that happen?
So in 2 weeks, I'll comment on it again. Maybe I'm not understanding the question.
Doctor, you're understanding my question. I just don't want to have people, oh, I'm wondering when we're going to hear about this from him. I think it would be fair for everyone's knowledge to know if you're going to do that 2 weeks from today, that's something we can work with. If it's a week from today, I think the public just wants to know.
2 weeks today, it might be the Friday night instead of the 2, but 2 weeks today.
Thank you very much.
Okay.
Sir, seconder for Councillor Van Passen's motion.
May I hear the motion again, please?
I might have gotten, correct me if I'm wrong here, that the medical officer for health be requested to evaluate the changes since March 24th, 2020, and that the medical officer for health be directed to reevaluate the criteria around the agricultural program in consultation with the agricultural community. Requested?
I would second that motion. I would like to speak to it, please. Is now as good a time as any? All right. I just want to walk us back a little bit. You know, from the public's perception, we've had some heated discussion today, and they're not always privy to all the conversations that we've had with staff. Staff have had it amongst each other, and they might be wondering why so much contention regarding the Section 22 order. I just want to walk us back a little bit, provide a little bit of context for why I've seconded this motion and why this has become a controversial issue in Norfolk County Council, the Haldeman and Norfolk Board of Health. There was an order limiting the amount of individuals residing in a bunkhouse, but there was also a subsequent direction. It wasn't a Section 22 order about identification cards for migratory farm workers. And this really exploded on social media, our new fourth estate, sorry, members of the media. But, you know, social media really took this and took it to some dark places. And the mayor alluded to earlier some comments directed towards herself as mayor and Board of Health chair, and also Dr. Nessathori referring to him as a Nazi. There was also some insensitive comments that I read about the Holocaust. And I would like to take this opportunity now, and I'm sure my colleagues would not disagree with me, to categorically condemn those comments. They are incredibly offensive, and I find it's the most base form of political debate, calling someone a Nazi. It's the most unintelligent thing I think you could possibly say during a political conversation. And it pays no respect to those that came before us, that fought for our freedoms. And it's very disrespectful for those survivors and those victims of the Holocaust. Jason Burgess, our CAO, issued a media statement to that effect, defending the good doctor from defamation and her worship, Crystal Chop. And that was the right thing to do. And I stand behind Jason Burgess in those comments. And I'd like to just speak to that today, because not everyone is on Facebook, and not everyone has read those comments and are aware that this has taken place. And so it's created a bit of a barrier between the agricultural community, who's trying to get their legitimate grievances heard and trying to collaborate with the good doctor, when we have this crass debate taking place on the internet. And I want to have an opportunity just to acknowledge that, this has taken place. We're moving towards having a constructive conversation. But there's also some comments from individuals that I respect about racial profiling, about cultural sensitivity. And I respect their views. They are not using that language in their criticisms, and I feel that they are unfairly being presented as holding those views. The farmers that are coming before us today, categorically, they do not defend those views. They're coming with different grievances. Maybe something was said by mistake. It's never too late to walk back or apologize for an insensitive comment. But I'm not going to condone those comments, and I want to start with, that's where some distrust has flourished, and that's why I feel the parties are starting to break down a little bit in their communications, because there's been some discord over these migratory worker cards. And it's a red herring in the debate. We should be talking about public health, not about crass comments on Facebook. But we are anyway, because that's where we are at today. And so where do we go from here? There is a lack of consultation for the identification cards identified by our migratory, the hosts of our migratory farm workers, the farmers. They feel the same way about the Section 22 order limiting the bunkhouses. And, I've articulated that today. Dr. Necessori has heard this. And I want to have an opportunity to speak to it. And that's why I've seconded the motion, and I will be voting in favor of it. But this is where we've come from. Just a lack of communication, in essence, and it's created sort of a snowball effect, where this has become a contentious issue, not only because of the lives that it's affecting. I don't want to dwell on economics, but we are the Board of Health, and if I'm talking about the social determinants of health, and income is a social determinant of health, and it has a very real impact on our farming community. I've had farmers reaching out to me worried about suicide, spousal abuse, alcoholism. We had a spike in opioid use during this pandemic, and it all can't be attributed to the Section 22 order, but it's hard to have one conversation in isolation. These things impact each other. I just want some acknowledgement from our board that this is a very complex issue. And the good doctor understands that. He's trying his best to explain that to us, to educate us. And our role, I feel, as a board member, is to bring forward those legitimate health concerns about what this is doing to the farming families and what this is doing to the people that they employ. And it is a hardship that they are enduring. We've had comments from many farmers asking for us to rescind this order today and to remove the medical officer of health from his position. I am willing to entertain rescinding this order, making it better, or looking to the future about what this order looks like tomorrow, a week from now, 2 weeks from now. Seems like a good touch point. I am unwilling to remove our medical officer of health during a public health emergency, and after as well. I don't think you have done anything, sir, to discredit the profession that you employ and your service to our community. So to those farmers that are asking us to remove our medical officer of health, it's something that I'm not willing to consider, and I don't think the majority of this board is willing to consider that as an option either. However, the request to review this order, to rescind it, I think is a legitimate one. And there's nothing wrong with us having a structured, constructive debate about this order and the impacts it's having to community health. This is the reason why I'm supporting the motion to have this revisited, to request to have it rescinded, because it's impacting the health of our community. Thank you.
Mr. Burgess.
Thank you. Through the board chair, I'd just like to acknowledge Member Rabbit's comments with regards to that, and with regards to building a relationship with the agricultural community. I've had a number of conversations with some of the leaders in the community, and to be clear to all the board members here, I've set two kind of parameters to the agricultural community. First one was There's no way you can actually have a relationship if one side truly believes the other side is acting with racist intent. And I made that clear, and I asked the agricultural leaders to be clear on that issue, because that's not a starting point for a relationship. The second requirement I've asked for the agricultural community to start having more effective consultation is to better articulate the rules of engagement with agriculture. We have a committee. I can tell you that, you know, when we were circulating some ideas and putting through the committee, you would get other farmers who would represent different ideas because they were in a different production zone, or they were, they were representing a commodity versus that, and they had different viewpoints on that. It was very hard to engage with it. So my challenge to the agricultural leaders is I just need to know the rules of engagement. If there's one committee, then that committee has to hold the agricultural community to account for that. If we need to engage with 200 farmers on an individual basis, well, I can do that too, but that's a different model. My days in Niagara, if we needed, there was a, Tender Fruit Board Association, you went to the Tender Fruit Board Association, went to the grape growers. If they signed off on something, all grape growers abided by it. That's how it worked. So those are the two things. We're working, we want to work together, but, I think we can do that, but I think there needs to be a few ground rules that we've set forth. So just so board members understand, that's where we're at with reestablishing that engagement.
So could you read the motion again for me?
That the medical officer of health be requested to evaluate the changes since March 24th, 2020, and that the medical officer of health be requested to reevaluate the criteria around the agricultural program in consultation with the agricultural community.
Now, to reevaluate the criteria around the agricultural program, is that not what we just spent the last 2 hours debating?
Thank you, Madam Chair. We debated whether or not we make the request that they rescind the entire order. And rescinding the order is not the problem. Nobody wants to get exempted from having to isolate people, new workers for 2 weeks. Nobody wants that. But it's the criteria when you have to actually do the isolation plan. That's where the problems are. And all I'm asking is that they review those criteria based on the fact that the conditions have changed since March 24th.
Go ahead, Councilor Martin.
Thank you, Board Member Chap. I'll support the motion just to simply put this to bed, because the last time I spoke, I confirmed with Dr. Nessathari that he would build relationships with the ag community, communicate with the ag community, commit to streamlining the process, and commit to reevaluating the plan, which he confirmed.
I just have one final question for you there, Councilor Board Member Van Passen. Could you just, you often, you're very specific with dates and items and holding staff accountable to council's direction. So could you just explain what your expectation is then? So they have are you expecting a working group to be formed? Are you expecting phone calls? Different from what's already going on? What exactly is because so far what I see is already happening and it's already offered, and Shanker evaluates this information on a daily basis. So it's not that I don't believe in the items in the motion, it's just that they're already happening. So I need to understand what the consultation process is so that Shanker can understand what your expectations are out of this.
Well, I think our CAO has also brought this to light, that I think there's a need for better consultation, better use of the knowledge base that's out there. I think several council board members have brought up the fact that, like we as members of the Board of Health have no idea what's going on until 2 weeks after it's already happened. And maybe there could have been some input before the fact rather than after the fact, and working with the agricultural community. Again, decisions are made based on the information available, but if you don't go looking for more information, so there's offers out there of help from the agricultural community. Maybe it takes a tour of a farm and going through what the food safety standards they're already applying, and is it possible to adjust that hard and fast rule of 3? Is there potential to base it on meeting other criteria, like a certain amount of square footage and a certain amount of space available, options of individual quarantine? Like, are there other options? It was put in place again with the information on the 24th of March. It has served a purpose. Conditions have changed. Is it time to change the conditions that we allow that isolation plan to be developed on behalf of the farmers? I'm more than happy to offer any help I can. I'm sure that Councillor Columbus has a great history and background in the agricultural community. I'm sure he'd offer his resources and where to find more. We're willing to do anything to try to make their job easier. They have been working 24 hours a day for the last 2 months, and if they were looking for more help, I'm more than happy to give it.
So for clarity, I was unaware, I think Marlene and Shanker could attest to my reaction at the EOC committee. I also was unaware of the other program, but we aren't generally made aware of lots of things that the health department do. We don't get into the operational aspects of things. So for clarity, I was unaware as well at the time. Paula, did you want to speak to this just in the context of the legal challenge right now that's going on? So I thought we just debated this for the last 3 hours in terms of Shanker is agreed to reevaluate his decision as time goes on, including reevaluating his decision, could be changing the numbers in a bunkhouse. It could be a number of things, but at this current juncture, he is not wavering from that decision. We do have a legal challenge now that is coming about against the Section 22 order. So to continue to debate this and to try, I'm just wondering if you could provide some perspective with.
All right, well, if it helps at all, the matter, materials have been prepared. The matter is going to a full hearing next week. A number of the issues that have been raised through the deputation and that we've heard, members of the Board of Health have received emails and questions about. I mean, those are live issues at the hearing. And our medical officer of health, it's his order that is under review. It's his order that he is asked to respond to. And I think the appropriate approach at this point would be to simply accept the response that you heard from the medical officer of health, that he will come back and report as he has willingly offered to do. He has continually reviewed data and considered it as he indicates, but the data doesn't come usefully except every couple of weeks. So I think that's where we're at. I think the hearing is ready to go. People have prepared their materials, and that will be the real test, I have to tell you. Allegations that people wish to make or positions that they take, one side of it or the other, this is why we have an appeal process under the Act. And I would request that we allow that to occur.
Can I pass the chair over to you, Councillor Marcelli?
Yes, Board Member Chop.
I guess I just would like to say, I understand, Board Member Van Passen, where you're coming from. I really do think that we've just debated this already. And Shanker said that he is willing, if there's a wall being put up and so on and so forth, they have 2 kitchens, they have 2 bathrooms, they have 2 fridges, they have 2, then there is an agreement in there already from our medical officer of health who has worked around the clock. So I would just prefer if we could let the appeal happen. Let's move through the channels. We have our responsibilities as Board of Health members. There is an appeal against our medical officer of health currently. Let's let that play out in those channels, and we will reconvene again. Is it not next week, but the following week? I don't think we've decided yet, but at the next council meeting, we will again have another Board of Health meeting, and we can revisit the matter then. So I would prefer that we do away with this for the moment, allow Shanker to do his job, allow the appeal process to proceed, and then find out where we stand in next week or 2 weeks at the next Board of Health meeting and receive another update.
Any further discussion by the board? The motion remains on the floor. I'll have the clerk read it one more time, please.
That the medical officer for health be requested to evaluate the changes since March 24th, 2020, and that the medical officer for health be requested to reevaluate the criteria around the agricultural program in consultation with the agricultural community.
Mr. Clerk, you will conduct the vote, please.
Councillor Geisens.
So we've
I'm
already
sorry,
made
Doctor.
a commitment. We've made a commitment to always have dialogue. So that has, from my perspective, we've already agreed to have dialogue about this. I think the issue is substantively, does the Board of Health support all the work that the people in the public health unit have been doing up to this point? And I have affirmed that we will have dialogue on this, and I'll report back on this at the next Board of Health meeting. And I recognize there's a bright line between the medical officer of health and the members of the Board of Health. But in my mind, I think that what has substantively been articulated by the Board of Health members is what we've always agreed to do and will continue to do. So to that extent, I don't want any signal that somehow the Board of Health is rebuking the professional staff who have worked right up to this point to effectuate the best public health management plan that we can. So that would be my perspective, and I think that the substantive dialogue has happened with the last motion as well. So forgive me for interjecting, Madam Chair, members of the Board of Health.
Mr. Clerk?
Councillor Geisens. Councillor Geisens? Councillor Rabbits?
Yes.
Councillor Columbus?
Yes.
Councillor Van Passen? Councillor Martin?
No.
Mayor Chalk?
No.
Councillor Huffman? No. Councillor Michelli?
Yes.
Councillor Taylor? Yes. The motion carries 6-3.
Okay, thanks, Hayden, for joining us. I don't know if you wanted to stay and watch the rest of the meeting. Okay. All right, I don't have the motion sheet. I think I lost it. I just have a motion that's been moved by Councillor Van Passen, seconded by Councillor Rabbits, that communication items 5A, 1 through 17 inclusive be received as information. All those in favor? That's carried. Moving on now, I guess now, Shanker, back over to you for the rest of your update, and Councillor Rabbits, hopefully you can get your other questions answered at this point, the other deputation.
So I think that, you want me to comment on social distancing? Yeah. Yeah, that's what I thought too. Jason, go ahead.
Sure, just to make it quick, because I know I'm between us and potentially a dinner or bathroom break. With regards to bylaw enforcement and social distancing, Jim Milson has been hired, as you know. He's rearranged our bylaw enforcement. We patrol now in 2 zones, east and
Councillor
west.
Hoffman, sorry, Jason.
Sorry.
Can you put your phone on?
Sorry. We now patrol in 2 zones, east and west zones. On the weekend, we're maximizing our deployed forces on the weekend. So this weekend we had 4 officers in the west end, so that's Long Point, Port Rowan, Delhi, and 5 on the east end, so that's Port Dover, Simcoe, and Waterford. Just to give you a sense of some of the activity, so on Saturday in Waterford, there was 25 warnings issued for parking and a few parking infractions written. There was a number of warnings issued for social distancing. Tends to be around people who fish too close together. We just ask them to spread out a bit to make it, to maintain social distancing. No infractions were ticketed. In Port Dover on Saturday, we had about 150 warnings for people to move off the beach and pier, which are closed for the public. Strangely, on Sunday, we had almost 100 also, even though it was a pretty rainy day, that we had warnings to move people off of the beach and stuff. So that's where the activity is. And we, as I noted in previous correspondence, we are maximizing our bylaw deployment on the weekends where we have the biggest amount of risk.
Councillor Martin?
Thank you, Board Member Chop. To Mr. Burgess, I noticed you said "we." Is there something else you wanted to add?
I think Member Martin is trying to, for the record, I did do a bylaw shift for a partial shift on Saturday. I did not issue any warnings, and if I know I had to take care of statistics, I think I failed on that. So I'm sure Jim Milson or the bylaw folks that I worked with probably are criticizing my activity level. So, but I appreciate the embarrassment.
Okay, so that was the social distancing practice enforcement. Is that B, or that was the update? Board Member Shelley.
Thank you, Madam Chair. I'm not sure where I'm going to put this in because I thought that I wasn't sure if Dr. Nesathere was going to also elaborate on the social distancing part, and I would have asked this question of him, I think, but I have had a number of inquiries from people who are essential workers that in the county, when they are doing whatever they're working at, and I'm not speaking, by the way, of county employees, just essential workers in general, that because of the restrictions, because of COVID, there are no actual places for them to go to the washroom. And I've mentioned this to staff as well, and I'm just wondering if that is something that can be addressed. I know it sounds like it's a minor issue, but it is a really big problem, and I have been relating to the fact that I drove to my son's place in Kitchener a couple of weeks ago, and of course we didn't go in his house, and we just stood at the end of the driveway and spoke to him and my daughter-in-law and the kids. And I realized, and then on the way home, I realized I had to go to the bathroom. There is no place to go. All the restaurants are closed. All the public facilities are closed. I'm just wondering, and that problem now is making itself known to our essential workers. So I'm just wondering how we can address that.
I'm going to start, Board Chair, and I'll pass it over. This is actually a subject of discussion in our EOC, to be frank. And it was actually probably the number one question when I was working on Saturday in Port Dover. And there's two sides to the story. When people were asking us for the washroom, I'd try to enter into some conversation, and none of those folks were from Haldeman, Norfolk, from that area. So there's the one argument that says if you open up the washrooms, it actually encourages some of the behavior that we're trying to discourage, which is people day tripping into places like Port Dover. And then there's, there is a financial aspect to it. If we do open up washrooms, the regimen to cleaning the washrooms is we'd likely have to have it staffed. There's an argument whether we would have to clean it after each use or every 15 minutes or half an hour. So the cost for that would be projected to be, in the $15,000 to $20,000 range per month if we wanted to open up a washroom in Port Dover. And it also encourages queuing of those lines, which also impacts social distancing. And then there's the counter argument to that is that, you know, people are still likely going to do their business and they might not be doing it in the most health effectuated manner. We did have this debate. I never thought I'd be debating bathroom policies at an EOC meeting. But at this point in time, our medical officers of health decision was not to open up the public washrooms. At this point in time, it's something that that we will review on a weekly basis, and I'll let the doctor respond further.
So the challenge with the bathroom is trying to maintain social distancing and maintain the cleanliness, as Jason had shared. I think at one level, we want people to have bathroom access for sure, but then how do we do it so it doesn't become a vector of spreading COVID-19? I'm not an expert on how these are organized, but I don't know if there's a way that we could limit access or if there's a structure. But my fear is that by opening the bathrooms, we'd also, and this is like every other inconvenience that we put forth with people with COVID-19, is that some people will benefit because they'll have access to the toilet, which is important, but it could also lead to another opportunity to spread an illness, which is also challenging.
Specifically to your point about essential workers, I admit to being confused about that. Essential workers should have access to facilities through their workplace. Your particular example was about you traveling out of district and traveling back, which is exactly what we don't want, including into Port Dover. So all I'm getting at is I don't understand how essential workers who would presumably be working at the supermarkets or in their offices or wherever they're working, who are the particular essential workers? So I don't actually understand.
Thank you. Well, they're not really traveling out of district. The people who have communicated to me about this are the types of essential workers, and I just use the specific example because I still haven't gotten an answer that I'm supposed to tell this person. We've explained all the costs and all the ramifications and all of the consequences, but this person works for a bug extermination company. They travel from place to place, exterminating pests and bugs and wildlife, and when they're out there doing that, so they do have to travel, but they travel within Norfolk County, from my information, and it is particularly difficult because one of the employees is a female, and she does not have the same access to opportunities to relieve herself that her male counterparts do, and that's the issue.
Sorry, through the chair. We face that issue also. We've had to open up buildings for our road crews. If you look at the Ontario regulations, one of the when they're opening up and requirements that an employer must have in place, one of the requirements that an employer must have in place is to accommodate that. So cases like some of the telecommunication companies, they open up buildings that may not normally be open up on the weekends. Their employees get passes to those buildings so that they can enter into it. We're doing the same thing with our employees. We're trying to figure out how to give the road crews swipe access to buildings in different locations. So that's an employer obligation that they have to figure out, and it's a requirement actually when they're developing their plans to return to work that they must meet those health and safety requirements of their employee. So and a plan to say we're going to rely on public washrooms would not, if it was graded, wouldn't get a good grade.
Okay, thank you, Madam Chair, and thank you, Jason. And now that's something I can tell this constituent, that it is up to her employer to do something to provide that opportunity. Thank you.
Okay, so I'm confused. That was item 6B then? Was that the social distancing? Did we jump over? Shankar, did you have more to add with your update?
Yeah, the one thing I would add for social distancing is that it's probably been one of the most effective strategies that we have had boil down the cases in the community. And the thing that worries me and concerns me is that as we relax certain rules, like retail shopping, that people will have a difficult time maintaining social distancing. So I think it's good for our messaging campaign, and you're all members of the Board of Health, is just to reinforce that it's important that when people are engaging in activities that they do keep the 2 meters apart. It just takes one cough to spread COVID-19, and if we can keep pressing forward with the social distancing strategies, I think that'd be helpful. I think it's still worth avoiding non-essential travel. I do think that if you have to do your groceries, do it once a week. I think those are things that could help. So I think it's still worth, as we pursue the pandemic, to continue with that activity.
Councillor Rabbit.
Thank you, Board Chair, and through you to the good doctor. This one may seem a little out of left field, but I thought I should articulate it anyway because I too have made some prominence to constituents that are calling me with health concerns and wanting some answers. This one is with regards to unwelcome solicitation. Newspapers thrown at the edge of the driveway, or even folks distributing something to a mailbox now. This is lawful from my perspective to drop off a leaflet or something to someone's front door. All I can do is to advise a person, put up no solicitation. When you're disposing of that, make sure you use a barrier between you and the thing you're picking up. If you're worried about someone dropping off something anonymously, like put on a glove or get one of those grabber extenders that you use to pick up trash. Put a barrier between yourself and the item that has appeared on your doorstep. I've similarly had conversations to the opposite, where folks are so worried about dropping off a care package that they're calling even our planning department or our health unit to get permission. Can I come drop off a care package at a loved one's doorstep? Is this permitted or not? They're asking first. And, these are conversations that I anticipate councillors are having as board members of health here with their constituents. And I was wondering what your perspective is on, those care packages that are being dropped off and unwelcome solicitors or, persons that may not be respecting social distance, and they're ringing your doorbell, they're knocking on your door. I want to talk to you.
Yeah, I can't comment on the legal issues, but from a public health point of view, it's okay to leave a care package on the porch, but be 6 feet apart. So I would say if you're going to leave a care package for somebody, call them in advance, tell them you're going to leave it, tell them to stay in the house, and then when you are beyond 6 feet, they can come pick that up. The challenge is that social distancing now pervades every part of our lives, right? And so it includes the interactions at the door, with the postal service, with any type of delivery. And I don't think, Pollock, our council can talk about the legalities, but I do think that it's important that when people engage in what are benevolent activities, many times they're trying to help somebody out, that they also recognize that it can be another opportunity to spread COVID-19.
Earlier at the outset, I had a brief conversation, or was attempting to provide you an opportunity to answer some of the deputations that we had received, even though we were discussing a motion at the time. Don't feel that you're being long-winded. I think this is all very valuable information. We're not meeting as regularly as a Board of Health or as a council to ask these types of questions of our professional staff. So don't feel like, and I guess I'll speak for myself, that you're taking up too much of our time. I find this very valuable, the information that you have to share, and that's why I wanted to ask you to have an appropriate response or an opportunity to respond to those deputations. Did we want to have a brief opportunity to discuss the secondary residences, sir?
Sure. So, when we think of COVID-19, it is the person-to-person communication. It's the person-to-person interactions between two people. And when we looked at the data when that order was written, we had more cases on an average daily basis. And if we think of Haldeman, Norfolk County as a bubble, which it isn't, but we try to minimize the amount of people traveling back and forth. The argument has always been the same from the very beginning. Stay at home, save a life. Stay at home, save a life. And we were trying to effectuate that goal. And when we think of what are our challenges, well, we have challenges with individuals who are traveling for sure, and we have, and there were, we were trying to effectuate the unnecessary travel between those two areas. When we wrote that order, we were worried that we would have more and more cases. And when I withdrew the order, when I rescinded the order, we had average daily census that was lower, so that was the rationale for that. When someone occupies a seasonal residence, it's just not the trip back, the individual trip forward and backwards, but it's also the repeated interchanges between back and forth, bringing extra people with them. It's hard to control a team. Like just people will have additional activities and parties, and that's just a normal course of human interaction. So that was the reason we wrote the order. The order is consistent with all of public health messaging, and that's true in Muskoka, and it's true in other places, that people who live in seasonal districts are worried that additional cases, a secondary spike, will ultimately lead to a secondary wave of cases, and especially trying to tax a relatively under-resourced healthcare system. So I think that was the challenge. The challenge is, how do we effectuate a public health plan, recognizing that some people might be disadvantaged, but the overall population would be advantaged. So I hope that provides some context.
Okay. Before we move on to the staff report with the dentistry, Mayor Hewitt has sat with us for 4 hours now, so I'm going to give him the opportunity to chime in. Mayor Hewitt, can I interrupt you for just 1 second? There's I think Member Taylor, are you able to hear Mayor Hewitt right now? Are people watching for some reason? I just got a message from Megan. Would you be able to stick your head in there and see? You've waited this long. Yeah.
Your council shares your opinion there.
Can you just try talking again? Just tell us this little story. Count to 10? Yeah. 99 bottles of beer on the wall. Okay. I think it's working now. Okay. Hey, hang on, sorry, it's not working. Does somebody else have a mic on, perhaps? Counselor Huffman, I can't see her. Shall? Okay, they're working on it. Sorry, Ken. I. Are we not able to take his sound into a microphone on and just project it from there? Okay, let's try again. No, it just went out, Andy. It's the battery.
I don't want to say in Haldeman County this would work a lot easier, but. It's working. Is it working now? It was. Yeah.
Okay, let's try.
Try. Count to 10. 1, 2, 3, 4, 5, 6.
Oh, wait, Shelley's coming around the corner. All good?
7,
Okay,
8.
perfect. So sorry, from the top.
Okay. Well, at least I'll know my quote by heart now. So sorry for those of you who didn't hear me and those that are hearing it again, but I do think it's important to appreciate, those people in the public need to understand that in this pandemic, success will always be measured as an overreaction. And I've learned this through countless hours and conversations with Shanker and watching a number of different outlets and seeing the events unfold in front of us over the last couple of months. And we've spent a considerable amount of time arguing, debating, and arguing more, and emailing back and forth. And I do say that we're very fortunate in the strength of some of the people that we have around us. And I can say that as a mayor, I'm very fortunate with some of the people I've had to help and support me. And in this Board of Health, at this level with the Public Health Services with Dr. Shanker, as much as I don't always like and agree with his comments, I do trust him emphatically with his decision-making process. I do think the problem for us is we come from an environment where we build consensus and we make decisions and we represent our constituents. And when you are in the middle of a pandemic, it changes. And when you see orders such as the Section 22 that you've spent a couple hours discussing, it's no longer a decision made by consensus. It's no longer a decision made that's necessarily
taking into effect the economics that we all use to guide and govern us. It's a dictatorship, and I don't think that there's any one of us on council, whether it's Norfolk or Haldeman, can appreciate or certainly support the idea or spirit behind it, a dictatorship. But that's in fact what it is. And no disrespect to you, Dr. Shanker, but that's what it is. And you know, as leaders, we're elected to challenge. We're elected to ask why. You know, and this pandemic has challenged that ideology and challenged, you know, really what most of us do to represent people. I'm listening to many of the conversations that have taken place, and it goes entirely against everything that we do as people who are elected to represent the people. And you know, I think that what we have to understand is that in the pandemic, you know, economics does not equal health. And what we're struggling with, and we've heard Shanker say a few times, is that tug of war between, you know, what is the appropriate level of risk. And people, you know, in this thing, they ask you, they joke about Groundhog Day and talk about, you know, wake up, wash, rinse, repeat, wake up, wash, rinse, repeat. Or are we almost there yet? And we've all heard that. You know, one of the things that that we continue to ask is when can you tell us those numbers are going to change? When can you tell us those numbers are going to change? And you know, I say this again respectfully because I've heard it for the last 6 weeks, but I'm too weak to death, just as I'm sure you are, and I hate that word 2 weeks, because that's what we continue to hear. And when we're in this, it is so fluid and so fast, it's difficult to imagine 2 weeks from now. So what is that, where does that leave us? And I think one of the things that I've seen in looking at this today, but also spending some time and trying to think this through, and why I think it's taken you almost 3 hours to come up with a motion and debate, you know, these two particular very challenging, polarizing orders, is that in the middle of a pandemic, the normal way of doing business for our combined joint social services program is challenged and simply broken. And Mayor Chop mentioned it earlier, you know, in the last 20 years, the decision made through the amalgamation was to have the arrangement set up the way it is. And while I think that it has worked for the most part under normal circumstances, it has failed us in this past 6 weeks or 8 weeks in this situation. And what I mean by that is not a challenge to the staff, you know, in their efforts or the work that they've done, because I think that they have been tremendous. But what I mean is our ability to represent both Haldeman and Norfolk, and our ability to also communicate to both Haldeman and Norfolk. These challenges that we're facing are happening so quick and so fast, and I'm hearing questions from members of the Board of Health that a lot of that are answers that possibly could have been, you know, provided for in a different way. And what I challenge to you as the Board of Health, and looking as when we come out of this, is how does the terms of reference look in the future? Not necessarily under normal operations, because I wouldn't have anything to say about how normal operations has worked. They've worked fine. But under a specific issue such as a pandemic, in a situation where we are in a state of emergency, we have to be more nimble. We have to be able to make decisions and support our team and our staff in a way that we can move quicker, but also be able to communicate those decisions back to yourselves as council and to council and Haldeman, because you all have not just that responsibility as members of the Board of Health, but you have that responsibility to communicate to your members, your constituents who are asking those important questions. And I know that my council is equally as frustrated with me and our staff, and not because we're not able to do it or we're not providing the information, but the information is such that it's very difficult to get don't want to take a lot more of your time because I know that you've spent a lot and considerable amount on this already, but I do want to say that as Haldeman County, we respect the work that you've all put in. We respect the work that the staff have put in, and we do respect our chief medical officer and his decision-making. We don't always like it. He knows that, and I hope I'm not saying anything out of turn, but I have been very critical over the last few weeks on different decisions. I don't always have to agree with it, but I do believe that, you know, he comes from a position of what's best for our community's health and looks at it from a perspective that economics is not necessarily first and foremost. We look at it from economics and what's best and foremost for our sector, whether it's farming or whether it's our small businesses. And that's the challenge. And with that, I'll leave you. I thank you again for having me. If you have questions, I'll answer any questions if you like, but yeah, I'm happy to be here. And I can say that the relationship that we've had working with the last 6 weeks with the Norfolk EOC and the board, our members of the Health and Social Services staff, has been very positive and very good. But we do have a fiduciary responsibility. We have looks like about a $1.4 million tab that you'll see later, I think, tonight, that's been growing with respect to the COVID situation. And Haldeman County is responsible for 40% of that. And currently we have no vote, no ability to exercise a vote, and no ability to manage or be tied or responsibly tied to that. So that in itself is an issue for us looking forward, and I think I just want to leave you with that, knowing that we will be looking for guidance and looking for a report from both staffs to look at how in this situation we can manage those finances and ensure that we're representing Haldeman County in the same capacity as you guys have done. So thank you for having me.
Thanks, Mayor Hewitt. Questions from any of the councilors?